When I think about it, there's many reasons why I feel the surgical and medical profession fits me so well personally.
It's perfect. Fits like a glove.
And yes, I love taking care of people. I love doing surgical procedures. But this is not some college essay application to write some cheesy thing to get in. I'm not here to try and impress upon you that you guys already know this. But how do you know if someone truly loves what they do? And I think the passion is evident when somebody sees the weaknesses in their field and wants to improve things and take things a level above they're striving for. I mean, think about a artisan, a woods craftsman. They build incredible pieces of furniture with beautiful, beautiful, pleasing looks, right? But an artisan who truly loves what they do, what are they doing? They are pushing that envelope, creating levels of detail, levels of beauty that no one has ever seen before. So much so that it surprises themselves and it surprises the public. And that's what I feel I am doing and I am striving for every day here in my office. So before I get ahead of myself, I am Dr. Chung. I am a board-certified proctologist or colon and rectal surgeon here in the United States and California. And today I want to talk to you about the improvements I've been making and how it's been impacting the patients I've been seeing. Because in here in this office, I have been seeing many complex issues, especially anal spasm and anal fissures. I think that's the biggest thing here. The second would be the hemorrhoids with the laser. And yes, patients have been calling me and contacting me through email and coming here from all over the world. YouTube has, of course, made this possible so I can send out the message and tell you guys, yes, there are doctors out there like myself who are interested in helping you with your bottom end issues. In today's video, I'm going to talk to you about the innovations with hemorrhoid surgery recovery. You know, in many videos past, like several years ago, I would tell you guys about the horror stories of hemorrhoid surgery. And back then, I was not doing laser. None of the innovations that I do now existed back then. I mean, I was just telling you what normal graduates from a colon and rectal surgery program in the United States, what that hemorrhoid surgery experience is, and is by far the standard in the United States and for many parts of the world too. And that's where I found the biggest weakness. I think to myself, there has got to be a better way to do this than what we're doing now, because it's an awful, scary experience. People are suffering with hemorrhoids and they can't get things done because they're absolutely terrified of what may happen to them. And I don't blame them.
I don't blame you.
That's why I said in my video, like, if you don't feel like these hemorrhoids are killing you, like, don't do the surgery unless it's really impacting you. Do I still believe that now? Absolutely not.
Absolutely not.
Because the hemorrhoid surgery recovery is something you can get through with help. There's many detailed steps that I've been working through and continuing to evolve to get people back to their life sooner without their hemorrhoids. So the first question you may be asking yourself is, Dr. Chung, how come my surgeon doesn't do this and how come only you do? And it's because, number one, they're my innovations, things that I came up with myself. But number two, it's my practice style. I am a one-on-one surgeon type of guy. So if I did a surgery on someone, I am responsible for you, and I will make sure that you get the attention you need to get you through the recovery process. There are no nurses here. There are no physician assistants. You have my cell phone number, and I am happy to help you. I tell people, don't even bother asking Google, okay? I am faster than Google, and I am way smarter than Google as well. And that is the personal care and the quality of care that I give to people. But I think with the hemorrhoid surgery, it deserves all that care. There's no other surgery I feel that needs so much care than what is so sensitive and so painful when somebody does surgery there. So if we were to go in the order of operation of things, the consultation is first. A lot of education, a lot of time is spent with you so that you know how I deal with things, what the protocol is, how to recover well, and what kind of bad things that could come up. That way nothing is a surprise to you. And I'll tell you that consultation is actually part of the innovation. The one-on-one time with me, going through all the instructions, answering your questions, increasing your knowledge, helps you drive that uncontrollable fear down. Because yes, you're going to be a little bit scared. That's completely normal.
It's good to be scared.
But knowing that I'm going to be there, knowing that you've chosen the right doctor to go through this is all part of my innovation. The next step is the surgery, and yeah, there's been a ton of innovation here. The cutting and stitching, the basic stuff, has now been changed, so when I do it, creates little destruction and also creates less pain for people. When it comes to the laser, this is one of the hugest innovations here because I use it in combination or without cutting and stitching in order to give people a much faster recovery. And I'll tell you, with the laser, you've got to have an experienced surgeon, someone who's going to be honest with you to give you good results. Because if you don't know the limits of this technology, you could be asking for an early recurrence of your hemorrhoids, right? If you just use a laser for very large hemorrhoids and they don't cut out that stuff that's swollen or redundant in your anus or extra stuff, you're not going to feel as good as you can. So in my consultations, I'm telling people the realities, based on what you got here, sir or ma'am, you're going to need more than just the laser. I'm just going to be honest with you. I can do just laser, but you probably may not be happy long term. And again, this is a very important part of the consultation because when I see you, then I can definitely tell you what I will be using and how I will be getting the job done. The next major innovation is Botox because we want to reduce the amount of spasm. We don't want that anus muscle to be freaking out and squeezing as much. We want to put the handcuffs on so that they are forced to relax. But this is not the normal Botox procedure that other doctors do. This is my own procedure that I've developed in my practice with my research here. And it's been incredible to see people with heavy spasm actually have a recovery that is much, much easier. Why? How do I know that? Because I've seen patients with spasm. I've seen them flare their hemorrhoids so bad every time they poop, and they cannot open their anus. They can't even poop or fart even. And the hemorrhoid skin tags balloon up like mushrooms and grow in an instant. That's the kind of issues that happen when you don't do the Botox my way. The normal Botox procedure, I'll tell you, is not effective. I've had to re-inject many other surgeons, Botox procedures for spasm, and that's how I know that my technique works much better. The next bulk of innovation has to do with the recovery, because oh man, surgery is one thing, but you're asleep for that. But after the recovery is like that big black bear or bull that wants to get into the china shop and just mess everything up. So what has been going on here? Well, overall, it's much faster recovery. People are getting back to work, back to their daily lives with minimal pain. And this is now happening for my patients on average day 7 to day 10. Used to be day 10 to 14. We're talking about 3 days earlier, 72 hours on average, okay? These are for people that are having the whole shebang hemorrhoid surgery. They're having cutting and stitching plus laser surgery. So these people are undergoing a lot of trauma in their bottom end, but I am getting them through much faster. The next huge issue in the recovery is pain. We always have heard about the nightmares about patients going into the emergency room. You can't get in touch with your doctors. The pain medication you have doesn't work or you ran out. So you're panicking. The pain is 50 out of 10. And you're like, oh God, somebody help me, please, right? And I'm not joking about it. This is something completely serious. But with my pain protocol that I have developed, I call my patients about twice a day. If you need more help, I'm texting and calling about every few hours even. I've done that for patients. Why? Because I want to make sure you're safe. My pain goals is to keep the pain under 5 out of 10 at all times. This is a huge, huge feat, okay? And this is not to be taken lightly. This is the reason why people do so badly in the hemorrhoid surgery recovery is because the surgeon's like, well, I told you it was gonna be bad. And of course, it's all over the internet and the media saying, you know, you're kind of asking for it, so make sure you're aware that this is gonna be tough.
Tough luck.
And to me, it's like, no, that is so 1700s, man. This is 2025.
This is the year 2025.
Let's move on. We do not need to have this be stuck in the dark ages. People have health issues with their anus, with their hemorrhoids, and people will benefit from the surgery when they have it done. The third major issue that people always panic about is pooping. Oh, pooping is rough. I mean, you have wounds there, and now you've got to be able to pass through that same opening. What about that first poop? What am I going to do? And this is where my recovery protocol comes in. It has been very, very successful in helping people have soft first poops and to have poops even while they are on heavy narcotic use. Of course, the narcotics and pain medications are regulated by me, and definitely I take care of you with that. But the number of people that get constipated because they've been taking these medications and they haven't been taken care of, you know about it. You hear about it all over the web. And remember a minute ago, I talked about the Botox? Again, here, this is what helps to prevent those muscles from freaking out. For 3 whole months, the muscles will allow you to poop much easier. And so with the things that I've changed, I've now made pooping a much less scary event. And I know you're thinking, that is crazy, Dr. Chung.
That's bananas.
And I'm telling you, it's the absolute truth. The next huge innovation in my system is the personal coaching. Yes, having myself in the ring with you to fight the challenges ahead, to help you when you get into trouble, to turn around and say, hey, what should I do in this situation? You know, I give you the secrets, the jabs, the uppercuts, the timing so you can win the fight, right?
I'm gonna win this.
I want you to text me.
Text me.
I want people to call me. I said, don't hesitate in the middle of the night. I am here for you. If you have pain, I can help you. That's exactly what I tell people. You know, send me that photo. I do not want you to wait a second. I want you to tell me what's going on, because for me, the earlier I can find something and solve a problem, it's far better than delaying. Or I was like, oh, go take a sitz bath. That is unacceptable to me.
Unacceptable.
If you need to come in or I'm concerned about something, I tell people, come in now. I've had people come in weekends. I mean, care doesn't just stop because it's Monday through Friday. I make it so that I am available to you. And that's, in my opinion, the most important thing. And it really envelops the entire experience. I am really about personal one-to-one care, personal responsibility, and I will help you as much as I can. I've said in many videos before, any procedures or any surgeries done to your bottom end has a big mental component to it. And when you have somebody who's available to you all the time and easily accessible, the anxieties come down. That means that the sensation or the perceivable pain also comes down. There is evidence of this existing. And therefore, people actually have a brighter outlook and find that they are looking forward and handling things much better than they would on their own. The wonderful things about these innovations, they can be applied to other situations like anal fistulas, anal spasm, anal fissures. And no, I am nowhere near done innovating. I love this field. I love what I'm doing. And I love the progress that I'm making, because now compared to the patients way back in the past when I didn't innovate at all, just doing the status quo, words cannot compare. And I'll tell you, the patients will tell you that as well too. There is simply no comparison. This was a total horror show in the past. No more. Absolutely not. It is 2025. We should be better. Our brains are smarter. The knowledge is much more readily available. And it's time to bring our bottom ends back into health and into light again and live with confidence. And so I thank you so much for sharing this knowledge. I've gained so much knowledge from you guys because you guys have been telling me about your struggles, telling me about the shortcomings in these surgeries. Sure, I've seen them in the office and in my training days earlier in the past, but you guys have been showing me things to help innovate and help bring things to a much higher echelon. We don't want to be fearful anymore. We want to know more and take care of ourselves better. And that's what I'm here to do as well. If you have questions, or you have issues that you wanted to talk to me about, definitely let me know. I'm also here for consultations as well. And I wish you the best. You take care. Bye-bye.